So today we're going to talk about osteoarthritis and heart disease. You know, you learn the darndest things from patients and other folks. I've had multiple patients ask me about arthritis and say, oh yeah, I've got arthritis, so that gives me some risk for heart disease. And I used to always say, no, that's just the inflammatory arthritis or arthritis diseases like rheumatoid arthritis and psoriatic arthritis. And they said, oh, no, I've got osteo. So I said, well, again, I don't know of any association. Well, there is. Pam, who is on our content staff, works with Chris and me in terms of developing content, getting it out there for you. She sent me several series of lit reviews where, or science articles where they're drawing a connection between osteoarthritis, just general old wear and tear type of arthritis, and heart disease. Now, after you start reading it, after you get into the details, it starts to make sense. And the link is not nearly as strong as it is for the inflammatory arthritis. What am I talking about? What do I mean? Well, hang on. We'll get there a little bit later during the program. But first, again, a word from our sponsor, who happens to be us, and basically just more descriptions of content that's becoming available. With one thing, I've got a surprise to tell you about the book. We are making major progress now, but we'll talk about that in a minute too. So previous topics that we've covered on the YouTube live channel: intermittent fasting. Why are we still debating that? You know, we thought when the New England Journal came out the day after Christmas 2019 with a good lit review and a good push the standards, make intermittent fasting a standard, we thought that would start moving the standards of medicine in the right direction, but not so fast. There was an article in the JAMA series that actually said, maybe it's not ready for prime time. So that's what that was about. For those of you who have gotten fairly deep into type 2 diabetes and insulin resistance, one of the questions is, are we burning up our beta cells, or are they just wearing out? Are they getting destroyed, or are they tired? That's exactly what we talk about there. Supplements are always so popular. A lot of people want to know what kind of supplements can help. And no, you can't out-supplement a lifestyle problem, but supplements do help. They're not expensive urine. And so one of our more popular YouTube live events over the past few weeks has been 5 supplements that boost cardiovascular health. Speaking of supplements, you know, supplements often become drugs. The big pharma finds a supplement that really works and starts making some adjustments to it, turns it into a prescription drug, and makes a lot of money. Is that what happened with Vascepa, the super duper fish oil? It's almost pure EPA, icosapentaenoic acid. Is that just a big pharma play, or is it real? That's what we covered in that YouTube. And another very important issue for our viewers, we've had so many viewers like Chuck Smith say, you know what, I lost a lot of weight. I went low fat, lost 50 pounds. Then I had a heart attack. I saw your channel, and then I realized my triglyceride over HDL ratio was 5. At some points, 7. So I obviously had insulin resistance, even prediabetes, even maybe full-blown diabetes. And I didn't know it. And I was on a low-fat diet. So I was pre-diabetic, and I was just continuing to jam more and more carbs into a metabolism that could not digest them. So interesting reactions to some of that. Again, one of our more popular YouTube live videos. Speaking of popularity, the insulin resistance webinar has taken off. We had one a couple of days ago, and people are saying, look, you know what? I've got a problem. And I didn't know it. My doctor didn't know it. You know, it's like that same thing that John Lorscheider, Jerry Kurth, multiple other viewers have said. I thought I didn't have this problem. What happened? Well, here's what happened. 80% of people get some sort of screening for prediabetes. If you consider fasting blood glucose some sort of screening, in fact, of that 80% of those, so 64%. And this is not screening every 6 months. This is not screening every year. This is screening every 3 years with a fasting glucose. That doesn't work. We see this all the time. John's number, for example, was 90. He had a perfect fasting glucose. But when we challenged that, his metabolism, his blood sugar went up to almost 300. I see that time and time and time again. So that's why the Got Sugar webinar is becoming more and more popular. We've got several different links out there. We're trying to get, we don't have the right ads, we don't have the right marketing, so it's hard to find it. If you have a question, if you want to find out, do you have a problem with your carb metabolism? Call us, go to our website. If you have trouble finding it, you can call Michelle or JR at 859-721-1414. The CVI, cardiovascular inflammation course, has definitely been the most popular. We've given that to a lot of folks who had a lot of interest in this space, but we've had, again, more people buying this course than any of them. You may have an interest in it. And at the end of the day, that cardiovascular inflammation, having your immune system attacking the plaque in your arteries, that's what causes the end game risk for heart attack and stroke. And you'll see why if you go in there. Speaking of popularity, the gold membership has been blowing up. We're getting more and more people signing up for that, because one of the key things you get with the gold membership is you get a visit with me. It's a doctor's visit. We were discussing it this morning. You actually will get prescriptions as well. So it's a great way to budget. It's a great way to get world-class level care for a very affordable price. Now, I mentioned earlier, we've got some big news about the upcoming book. That's not exactly going to be the title, but it's going to be very close. The title is going to be, if I can remember it correctly, Prevention Myths. And then the subtitle is Why a Stress Test Can't Predict Your Heart Attack and What Tests Can. And that's really what the book is about. How do I know all this? I met with Todd and our publisher last night from 11 o'clock till about 1 a.m. See, the publisher's in Australia. Todd was actually flying in two different time zones yesterday and last night. So, you know, a lot of stuff to juggle. But again, very excited. They're thinking within the month the book should now come out. What we will start doing, I sent some information to Chris. We've got pieces of the book coming out so you can start to get samples of what's in it. For example, I sent Chris a major section on cardiovascular inflammation. There's a lot about that in this book. So we'll be getting that up on the blog for free, obviously. And we'll be creating some YouTube content around that, some YouTube live content. Another very much related piece of content in this space didn't come from us, and we almost stopped the presses again to include mention of this article. But we'll put it out in the YouTube live and the blog. Excuse me. And that article came from the Washington Post. I believe it was June 10 of this year. And here's what the Washington Post article said. Because of COVID, the number of stress tests has plummeted. It's fallen off a cliff. Now, think about it. Before COVID, stress tests were needed. They were important. They were life-saving types of things. You could predict whether you'd have a heart attack or not. Again, life-saving activity. Well, why did so many of them stop during COVID? Well, the author of that article in the Washington Post is a physician and a regular contributor to their medical side. And he covered something that I've already covered on this channel. The ischemia trial, I think it was in the New England Journal back in March, where it basically showed that, you know, bypass grafts really don't prevent heart attacks. And he also talked about other studies that we've covered, the Courage trial, the Promise trial, which showed that, you know what, stents don't prevent heart attacks either. And I know every time I say this, I get comments that, you know, you got to have thick skin to go on YouTube, but I get a lot of comments that say, you know what, my stent helped, or my bypass graft helped. Don't want to go there. Don't want to tell you yours didn't. In fact, the stents that are applied at the time of a heart attack are clearly life-saving. There's no question. Guess what portion of stents that is? 80, 70, 60? 10% of stents are placed for proven reasons to get a clot out during a heart attack and save the heart tissue. The other 90% are there to prevent a heart attack, and they don't work. Don't believe me? Don't want to go to New England Journal? Go to the New York Times. Go to the Washington Post. This information's out there and available. So, you know what? I spoke ahead of myself. This is some information from that Washington Post article that came up a few weeks ago. Actually, a couple of months ago now. Questions grow about the need for cardiac stress tests. Stents and bypass surgery are no more effective than drugs for stable heart disease. Highly anticipated trial results show. Now, that's an interesting quote. And obviously, it sounds like it came from a doctor. They're no more effective than drugs. So let's just give drugs, right? Here's my comment down at the bottom right. As we know, drugs don't work like lifestyle. So again, you can't out-prescribe, you can't out-stent, you can't out-bypass a lifestyle problem. So if I'm getting if I need to curb my enthusiasm, thank you for your patience. Speaking of enthusiasm, we're very excited. Our website used to be an old, ugly brochure website, and not a good one at that. A year ago, we were getting about 300 visits per month. We're over 20 times that now, with about between 6,000 and 7,000 visits per month. It's becoming a destination website. There's a lot of content on there now with the blogs. We've got, gosh, way more than a couple of dozen, I think. And it's content that came right out of this channel. We've got, and it's in writing. So, you know, those of you who, I think by definition, if you're watching YouTube Live, you might not be a reader type. But if you know people that are reader types, reading type learners, the content is growing rapidly in writing in the blogs on our channel. One of our most recent developments for the website is that our prescriptions, our supplements, we are now making our supplements available on the website. I'm starting to see significant pickup in that space. Before we go to the Q&A section, I just wanted to mention something. I keep getting people saying, hey, Doc, what's going on with this? This is another NDMA recall and another one related to metformin. So let's talk about it for just a second. On October 5th, this month, the FDA announced the latest recall of extended-release metformin. It involved Mark Sands Pharma Limited and Sun Pharmaceutical Industries. It involves the 500 and 700 milligram tablets. The investigation and recalls follow similar ones for contamination of popular heartburn meds, Zantac, and blood pressure meds, losartan and other ARBs, angiotensin receptor blockers, for those of you who are curious. Also for other nitrosamines. Since December of 2019, the FDA has been investigating the presence of nitrosamines like N-nitrosyl-dimethylamine, NDMA, because NDMA is a possible carcinogen. Now, let me just break off from the written content for just a second and say this. They've said this from the very beginning, and I agree, always have agreed. The risk on cancer from these medications is far lower than the risk of heart attack, stroke, etc., that you get benefit from on these medications. So they've said from the very beginning, do not stop taking your metformin or your ARBs, your losartan, and your other ARBs. So more than 175 drug combinations have been recalled since late May. The recalled metformin products can be seen on the FDA's website. And if you're looking at this, you can go to the link, and we've provided the link for you. Chris did. The agency said that immediate release metformin does not appear to have the same contamination problem. I would remind you that was a few months ago. The immediate release, or several immediate release products did have that. The FDA says patients taking metformin that has been recalled should continue taking the medication until a doctor gives them a replacement or a different treatment option. And yes, if you have concerns, as usual, we can help. That's a big part of what we do. So we're gonna do a little transition here. Aspen will give us the, I think it's the water ball and a little music or something, and then we'll go into the program on osteoarthritis. So you know what, I don't know if I'll ever learn it. Maybe I'm too arrogant. When patients say, oh yeah, I've got this, and when I say, oh no, that's not right, you know, a few of them have said, you know, I've got maybe some increased risk because I've got osteoarthritis. They were right. So, but again, it's still not like the inflammatory arthritis. So let's talk about it. Osteoarthritis and heart attack and stroke risk. OA, we'll call it OA, and cardiovascular disease, CVD. They're two of the most prevalent conditions affecting the US population and any aging population. Both are characterized by slow accumulation of disease or pathological change, eventually leading to adverse health outcomes. They share several risk factors, including age and obesity. What else has age and obesity? Well, diabetes, prediabetes. What is OA, osteoarthritis? It's the most common form of arthritis, for sure. It's a highly prevalent, it happens a lot, very common chronic disorder. One of the leading causes of disability among the elderly. As you see these pictures on the right here, we've shown a lady with what we call joint mice, you know, swollen joints from osteo problems. And we'll show a picture of rheumatoid arthritis in a few minutes. Rheumatoid arthritis tends to hit these joints, the metacarpal, the MP joints, the joints between the fingers and the hands. As you see with osteo hits the IP joints, the interphalangeals, these joints out here, the knuckles. That's a generalization, but again, that's what you usually see. One of the most common areas to see significant osteoarthritis you see on these two pictures on the right, in the knees, it is a big deal. No, I've already covered that. Osteoarthritis occurs when the protective cartilage that cushions the ends of bones wears down over time. And it's associated with increasing age, female gender, obesity, injury at the joints, occupation. In other words, do you work with your hands? Do you work walking or running? Physical activity. Are you a runner? A jogger? Although OA is the most common rheumatic disease, I probably should have changed that to say arthritic disease, because people, when they think rheumatic, maybe they think rheumatoid. It's the most common arthritic disease. Very little is known about it, though, especially in terms of the relationship between OA, osteoarthritis, and cardiovascular disease. Now, as I said, I was unaware of it. I had not thought it through. And yes, to credit on that position, it's a fairly subtle relationship. But once you start thinking about it, it makes sense. Physical inactivity. If you've got major joint knee problems, how are you going to get a lot of high intensity intervals, aerobics? You can. Well, that's one of the things that we do, is help people problem solve in that area. And Janice is very good in that space. But again, it has an impact. Chronic inflammation. Again, this is the significant difference between OA, osteoarthritis, and rheumatoid arthritis, or psoriatic arthritis, the inflammatory arthritides. Osteo is not an inflammatory arthritis. It doesn't get nearly as much inflammation as the others, but there's still some inflammation. That's the point they're making here. It's referred to as a degenerative disease, but recent studies have shown that there is synovium, or that padding, inflammation in that area, and that plays a role in the development of osteo. Muscle weakness. You remember, we've said multiple times, especially after we get to age 65 and beyond, one of our absolute biggest risk factors is loss of muscle mass. Well, guess what? If you can't move your knee very much and weight bear because of osteo in that knee, guess what that's going to do to the biggest muscles in your body? Your thigh muscles, your hamstrings, your quads, and your calves. So that is a very, very big deal. Non-steroidal anti-inflammatory drugs, NSAIDs, these are commonly used to treat OA. And NSAIDs are associated with increased risk of cardiovascular disease. So, OA and heart disease. So let's start taking a look at some of the studies. Here's one of them in BMJ, the British Medical Journal Open. The purpose was to determine the association between osteo and cardiovascular disease. It used data from the Canadian Community Health Survey, cycles 2000, 2001, 2002, 2000, all the way up to 2005. They identified 41,000 self-reported osteo sufferers. And they selected a one-to-one match for each of those sufferers, and they matched them by age, gender, and CCA and survey cycles. So what that does then, by the way, is that if you adjust for age, then all of a sudden, age is it's been adjusted out, and it cannot be one of the reasons when you find a difference. If you find more osteo or more heart attack in the osteo group, and you've adjusted it for age, then it's not age that's causing that problem. So the primary outcome that they were looking at is self-reported heart disease. Secondary outcomes were heart attack, myocardial infarction, angina, heart failure, and stroke. So they did some sophisticated statistical activities. It's called multivariable log regression or logistic regression. Obviously not going to go down that bunny hole. But they estimated odds ratios and looked at sociodemographic status, obesity, physical activity, smoking status, fruit and vegetable consumption, medication use, diabetes, hypertension, and chronic obstructive lung disease. The results? Osteo is significantly associated with any heart disease, angina, and heart failure in both men and women after controlling for confounders like age. So the odds of heart disease were 45% higher in persons with osteo compared with the age match controls. Most associations appeared stronger in women than in men. And as you remember, osteo is more common in women than men. Anybody know the reason for that? I don't. I will say that joint injury is usually adjusted and protected by the muscles, by development of muscles around the joint. So greater musculature around joints may be one of the reasons why men tend to have less osteo. I certainly don't know the answer to that, whether that's the truth. And I don't think anybody else does either. But it's an interesting theory. I'd love to see some science around that space. Why women have a greater risk for osteo. Anyway, women have a greater risk for osteo associated with cardiovascular disease as well. Osteo was significantly associated with heart attack among women only. Now, other types of heart disease with men as well. But it was not associated with stroke. Now, what does that mean? Is that real? I don't know. To me, it sounds like just what we call a signal, a research signal, something you find once in one study. But you never know. I think we're gonna need to have that's why you always hear at the end of these studies, we need to have more research. So, Aspen, you want to play that video, and then we'll go into the Q&A. So now we're doing the Q&A. And you know what, Aspen, I think I threw you a curve with that previous water ball break. I don't think we've done those in the past. Thank you so much for paying attention and supporting me and helping me not make myself look silly. I do enough of that already. So to the comments, we got a hello early from Amer Al Gayer. Hello, Amer. How are things in Germany? Then we got a hello from somebody who, I wonder, Bambi Grage. You know, Bambi, there was a Bambi Abel that used to watch and comment a lot. Wonder if you, maybe not the same Bambi. Anyhow, Bambi Grage attended the Got Sure webinar this week. We had a lot of folks saying at the end, I may have more of a problem than I thought. I need to get checked. So that's where that's going. Thank you again, Bambi. Brian Schmucker, what does the research say about the role of the brain in glucose control and insulin response? Well, we don't talk about it a whole lot, Brian, but it's a really good point. The brain has a cell, and I was going to say I think it's in the ventromedial nucleus, but not sure, and really doubt that it would matter to very many people anyway. But it's got a nucleus. There's a nucleus in the brain. And what it does is it's a gauge. It measures our blood sugar. And it says, okay, if our blood sugar is going up, as it's going up and passing 120, we need to start, or 100, we need to start putting out insulin. And then it tells the pancreas to put out insulin. The reason that's a very important issue, Brian, is you start looking at people that as they develop insulin resistance, those insulin receptors in the cell membranes start getting rusty. They don't work as well. Despite the fact that you put out the amount of insulin that you used to put out, your blood sugar is still high. The brain notices that and says, okay, we need to put more insulin out. And then guess what? Then you start getting into this problem on a regular basis. And then the nucleus adapts. Just like so many things in our body, the nucleus up in the brain says, you know what? Things aren't working very well. I'm going to have to run hot. I'm going to have to just get used. I used to, when my body, the owner, was in his or her 20s, I used to keep the blood sugar around 80 or 90. Now that's not working for us, and they'll adjust to where, you know, people will come in and their fasting glucose is 110, 120. Their body has adjusted, and their average glucose numbers, again, in the 80 to 100 range, their body gets used to having average glucose numbers in the 100 to 120 or higher. So that's where the role of that, the brain comes in glucose control. Great question, Brian. Thank you so much for giving me yet another opportunity to run down that bunny hole. S55B, good morning from Florida. Good morning to you. Which part of Florida? We used to live there in the Panhandle, and I've worked down there. I've worked in Sunrise, Fort Lauderdale, and I've worked with a group called MDLIVE. Still do a little bit of work with MDLIVE, and with another group in Tampa called Physician Partners, major Medicare Advantage group that's doing everything they can to keep their Medicare enrollees healthy. Amer from Germany. Hi, hello, thank you. Bart Robinson, good to see you, Bart. Good morning, Doc. Tuned in and ready to go. My BJJ, and again, for those of you who don't know, and maybe BJJ, I'm spilling the beans. Tell me if you don't want me to tell people, but BJJ means Brazilian Jiu-Jitsu. Good morning from Temecula, California. Grace Harlow, good morning from Virginia. God bless all of you. Thank you. BJJ, sometimes it feels like fighting the tide. Isn't that the truth? Wait a minute. What happened here? This is so weird. Wonder why it's doing that. Okay, my friend 58 has MI and multiple stents. Oh, had an MI. In other words, myocardial infarction or heart attack. Doc's puzzled because normal lipids. Oh, I wonder where this is going. I tested him after a high-carb meal with my glucose monitor, 200. Yeah, BJJ, thank you so much for sharing that. And I hope your friend appreciated what you did. Again, we get so many people doing exactly that. So part 2 of that story, I told him about insulin resistance, sent info and suggested he make changes. Gave him Jenny Rule's book, Blood Sugar 101, probably. There are several that she's done. I doubt he'll read it. His doc ran a fasting blood glucose and A1C and said he's totally fine. He's diabetic. I agree with you, you know. Welcome to my world. Now, you know, BJJ, this story reminds me of something that we're going to start doing. There was an article that came out from the NIH. I think it was a joint activity with the CDC, the NIH, several other people. Now, don't get involved in hating on them. Here's what they Here's what they're talking about. It's called healthcare literacy. Janice showed me that article and I started reading on it. And here's one of the biggest issues. Guess which age group has the lowest healthcare literacy? $20-year-olds, 30-year-olds, 40-year-olds? No. The baby boomers. People 55 and older know the least about health and healthcare. Now, one of the things that I've gone round and around myself is this channel is not for your typical 6th grade level education. I mean, talking about cardiovascular inflammation, talking about biomarkers, talking about even using the term osteoarthritis, or even using the term MI, myocardial infarction. Your typical 55 and older doesn't understand that stuff. So, you know, one of the things that's given me massive headaches is trying to figure out how to serve that population, because it's by far the biggest population of 50-year-olds and older. Here's where I came out. You know, I do what I can, but it's really more of a token effort. We've had people on like Janice and some of the other doctors that have joined us that tend to talk at that more generalized, lower level for more people to understand. But here's my perspective. And it's, guys, the folks that watch this channel and can actually, you know, wade through, keep up with some of the stuff we're talking about, really are the leaders in your family, the leaders in your peer groups, the leaders among your friends in terms of health literacy. You guys have to start thinking about stepping up, saying, look, you know what? I'm going to help folks. And BJJ, thank you so much for doing exactly that. And again, I think I share your frustration. Hear it all the time. Once you finally start making progress with the patient and getting them to understand that they've got a problem, unfortunately, quite often they go back to their doctor. And their doctor doesn't know. And all that activity you feel like is wasted. It's really not, but it's not easy, is it? So BJJ, try to tell him that a score of 200 means he probably has full-blown diabetes. He's listening to his doc that says, don't worry about it. That hurts. James Osborne, are there any supplements from the 5-supplement video have any adverse reactions with any or ACE inhibitors, vasodilators, cholesterol drugs? Should you discuss them with your doctors? Well, I'm trying to remember. And nothing's popping up. You know, there's one question that happens over and over and over again, James, in terms of supplements for cardiovascular health, and that has to do with vitamin K2. Here's the thing. It's not so much vitamin K2, although there is some question in that space, not really that much. But you don't want to confuse that and take regular vitamin K if you're taking the VKA, the vitamin K antagonists. And that would be things like warfarin. The things that antagonize vitamin K and stop clotting, and then you turn around and take vitamin K. You don't want to do that. But again, regular vitamin K is not the same thing as vitamin K2. So if that gets a little bit confusing, we've got a blog article on that. Aspen, Chris, maybe somebody out there, you can fact check me. I know we wrote that article. I think it is up now and available. If not, let me know. We could and maybe should also go ahead and do a video on that. E55B or S55B had a stroke end of February. Sorry to hear that, but thank you so much for sharing it. Just a few months prior, my triglycerides were 63, HDL was 65. Thank you so much for sharing that. Then the next question is, what were your inflammatory panel numbers? What was the full-blown insulin resistance program? Several other things. Again, thank you so much for sharing. James Osborne, seems almost futile to discuss anything with my doctor. Doesn't seem to know anything about in-depth prevention. Well, that's not uncommon. We see a whole lot of that on this channel, and it's not just because it's with this channel. The research has been done. I mean, I don't have to tell you this, or maybe I should. Out of typical 200 graduates in a medical school graduating class, guess how many go into preventive medicine? 1, 2. Preventive medicine docs are rare, not very common. Again, I know I ran one of the top programs in the world, the one at Johns Hopkins, and that is a frustrating thing. What do doctors tend to go into? Well, let me tell you this. They're going to make a heck of a lot more money going into cardiology, for example, which is very common, orthopedics, neurosurgery, any of the procedure-based kind of things make a lot more money. We need to change that. But that's, we needed to change that 30 years ago, and we still haven't gotten there. James Osborne, is there a specific day and time you do your live streams? Very informative. They're a blessing. Thank you so much, James. And, James, you should get on our, you should go to our website and give us your email address. We send out, let me see if this is, if I've got this. Don't see it, but sorry. I'm showing you my email. I'm sorry. I wanted to show you that we send out an email every Tuesday. Every Wednesday morning. We have this video, this YouTube live every Wednesday at 11. And yes, you can attend. You can impact the actual show by putting in your questions, just like you did now. If you join the group, you'll get updates on the content like this that's available. Thank you for the question. And while I'm thinking about it, I usually forget to ask this. Usually somebody reminds me, like Joe or Bart Robinson. Please hit a like. If you guys do that, that tells the artificial brain at YouTube that humans are watching this. Humans are thinking this is important, and send the link to others. Again, that's a major boost for this content as well. My BJJ, studies show metformin helps reverse memory loss in dementia. My mom has mild dementia, and I have her on lower carb. It may be helping. Any thoughts on metformin for mild dementia? Oh gosh, again, this is like having a shill in the audience. Thank you so much. I was doing some prep for the Got Sugar webinar a couple of days ago, and I ran across this study that just caught my eye, blew my doors in. It's so interesting. Huge study, 145,000 people. And the comparison group was taking metformin versus not taking metformin. And it was, unless, again, fact check me, we'll get that information out again sometime. But it was like a 40%, 45% decrease in dementia, development of dementia among people taking metformin. I'm tempted to do another little digression like I did a minute ago to go actually find that slide, because I had that slide. It's in the Got Sugar webinar. So yes, metformin, big deal. The other one was pioglitazone. People taking pioglitazone had a significant decrease in dementia. So yes. And the thing that occurred to me there was I have spent very little time making that point when dementia is such a big deal for so many people. if we helped them understand what sort of things actually decrease dementia, perhaps we could do our job better. Thank you so much, BJJ. Susie Penguin, years of typing. Yep, already have it in my 50s. And I'm guessing that means you've got some osteoarthritis in your fingers. Thank you, Susie, for sharing. Parker, I'm dying. Well, you know what, Parker? Goodbye. Steve Mitchum, thank you for all your information, Doc. You've surely prolonged lives by putting this information out there. Thank you so much, and I hope it doesn't sound arrogant if I agree. Yes, it's clear. People are making comments on this channel all the time to say, Doc, hey, Doc, you know, I got your studies, and I don't have prediabetes. I've got full-blown diabetes, and my doctor didn't know. And with this new information, I'm going to save decades of my life. You helped save my life. Thank you. And I get that all the time. I got that from OAG, Old Alabama Gardener. I got that from John Lorscheider. I got that from plenty of other folks. Thank you so much, Stephen. And here's the thing. It's a lot more, you know, the way I enjoy golf, I enjoy traveling, but I enjoy this a lot more. And, you know, despite the experience that BJJ shared, you can save lives too. Just hook them up with this information, help them get aware. And, you know, it's not easy. As BJJ shared, unfortunately, sometimes they'll go to a, quote, expert, a physician, who the science has shown clearly don't understand prediabetes very well. And they'll fall back. But be patient, keep doing the work, and you guys are saving lives too. You really are. And to that point, you know what, BJJ, given my experience, I can also tell you this. Your friend is not going to forget what happened. And yes, he may be listening to his doc for right now, but you've got a very good shot of him taking a deeper second look at this issue. Be patient, continue to push. Thank you. Art Berry, sometimes in treatment, one is damned if they do and damned if they don't, but at least one can have the initiative to control lifestyle and be healthy. Well, the other thing about it, Art, thank you, Art, for sharing that, but the other thing is, you know what? Lifestyle's three times more effective than drugs and procedures and supplements anyway. So lifestyle is a hands down winner. Susie Penguin, my husband and I are on low carb keto and ketovore in my case. You know, that's an interesting term. I can guess what that means. And the pain and inflammation from osteo is vastly improved in us both. Avoiding veggies and lectins may help. Very interesting. And, you know, one of the things I've said, I get a whole lot of really emotional, passionate debate about low carb, low fat, plant-based. A lot of people saying, oh, don't ever do this carnivore thing. And my perspective on the carnivore is it's got to be a lot safer if you've got prediabetes to go carnivore than to go low fat. Another point I didn't connect until I was investigating it a little bit deeper is that carnivore is the ultimate elimination diet, or one of the ultimate elimination diets. And I think that's what you're talking about, Susie, yourself. I'm not carnivore, probably, I doubt I ever will go carnivore. I tend to stay, for the most part, used to be very plant-based. As I continued to drop my carbs and as I continued to investigate things like TMAO, I've gotten a little bit more, added more animal products back into my diet. So thank you, Susie. Very good share there. Clinton N. Look like Pelosi hands. Yep. You know, I thought I had a slide in there on. Actually, I did, and I forgot. I misplaced it, so I forgot to put it there. Let me go back and share just a second. Aspen, if you're listening, hopefully you can put this on share. The the arthritis associated with the inflammatory arthritic diseases, especially rheumatoid arthritis, is classic. As I mentioned before, you get that, what we call ulnar, this is the ulnar bone, ulnar deviation on these joints. You get some other things too. But here's the thing, look at this. With rheumatoid, and this lady has them, with rheumatoid arthritis, you get a lot of biochemical, cellular, inflammatory activity. This inflammation actually goes back and cross-reacts with inflammation of the arteries. Therefore, the inflammation in and of itself with rheumatoid arthritis, psoriatic arthritis, and I got a lot of those patients, that causes a significant added increase to the inflammatory process and therefore heart attack and stroke risk. Psoriasis, we talked about psoriasis in the past. You know, when I had this stuff on my face, I was taken for basal cells. You know, we talked about this is what inflammation looks like on the outside. Most people don't get it when you talk about inflammation of the arteries. But then when you show Tommy Lee Jones as Two-Face, or when you show my face, or when you show Kim Kardashian West when she's having problems with that. Or it's not Sting, it's not Steele. He goes by one name, and he's Heidi Klum's husband. He has lupus. You've got a lot of people that have inflammatory diseases. These inflammatory diseases significantly increase the risk for cardiovascular disease, just from the inflammation itself. So thank you again for giving me a chance to go down those bunny holes. So, we're lost now in terms of, gosh, this happens when we get a lot of people on, we get a lot of participation. If I've skipped yours, let me know. I think this is the next one. Steve Mitchum, I tried to share this information with people, but they dismiss it because their doctors say they're fine. Yeah, it hurts, doesn't it? You try to, you try to do something good for people. You try to save their lives. You try to help them save their lives. And they go to the quote expert, end quote, and they get told to ignore it. Painful. And again, as I've said before, we've got science on that. There are reasons why doctors don't understand this stuff very well. And it's really clear the doctors don't understand this well. I'm not beating up on docs. It's a problem that we know exists, and we, as a culture, as a group, we need to continue to work on it. That's what gives me something really gratifying to do in my retirement. Susie Penguin, looking forward to trying NutriSense CMG, CMG, to get 24/7 read on blood. I think you meant CGM, continuous glucose monitoring. And I was not familiar with NutriSense CMG. That is interesting. I'd be very interested to hear more about that, Susie. To get a 24/7 continuous read on blood sugar to see what foods may be causing issues, even on low-carb diet. Need to reverse husband's prediabetes. You're doing the exact right thing. That's one of the major campaigns that I have in this channel too. And we have a program where we'll even write the script for people to get a Freestyle Libre, because the Freestyle, up until the Freestyle Libre was approved here by the FDA a couple of years ago, the only thing available was Dexcom. And Dexcom is great. It's better in many ways than the Freestyle Libre, but it's $750 to $1,000. The Libre is $35 to $70 for 14 days. I'm not familiar with NutriSense. You know, I got to check that out. Thank you so much. CGM, yeah, okay. S55B, A1C was 5.3 CRP normal. Here's the thing about A1C. You know, when John, several others, if I've heard it once, I've heard it 1,000 times. Doc, I know you're a nut about blood sugar. My doc checks it all the time, and we're fine. As I mentioned, I think in the beginning, if you look at the science, docs don't check it all the time. 80% of us get some sort of blood sugar thing, but it's like fasting glucose once every 3 years. If doctors even got A1C, that would be better than fasting glucose. But there's a reason why the AACE, American Association of Clinical Endocrinologists, and the ACE, the American College of Endocrinologists, say, don't use A1C to diagnose diabetes. Wait a minute. Did you hear me correct? Did I hear that guy correctly? Did he say, don't use A1C to diagnose diabetes or even prediabetes? Why? That's what everybody uses, right? And did he also say the standards committees say that too in endocrinology? Yes, that's exactly what I said, and that's exactly what they said. You know, maybe I ought to get out some of that Gut Sugar webinar deck and show you this. Here's why. A1C is deceptively wrong in certain situations. If you're not Caucasian, if you have genes that are not Caucasian, if you are, if you have anemia, and how many anemias are there? Are multiple types of anemias. Anything that decreases blood cell, red blood cell activity, red blood cell lifespan, that automatically throws off A1C. If you have beta thalassemia, and there are a bunch of thalassemias, those are genetic differences in the in hemoglobin. In fact, it's more than just the thalassemia differences in hemoglobin. All of those. For diagnosis of maternal diabetes and prediabetes. So you know what? Not only did we just wipe out all the ethnic groups other than Caucasians, we just now wiped out all the genders other than male. We just wiped out anybody that's got a very common problem called anemias. Oh, and by the way, if you have kidney disease or kidney failure or liver failure. So hemoglobin's great if you're a male without any of those problems and you happen to be Caucasian. If you're not, be very careful about using A1C. Thank you, S55B. It was a great opportunity. So Chuck Rogers, greetings, best doc in America. Thank you very much. I greatly appreciate that, Chuck. Ruben Gaspar, acne. Well, I'm not sure if this is where you were going, but inflammation. When Tim Russert died, and the book, by the way, starts off with a great video I found with when the doc and the news announcer came on and announced Tim Russert's death. The autopsy at that point, excuse me just a minute. Have you noticed that? Isn't that weird? This is use of green screen. And this is a green bottle. So, acne. Tim Russert died. He was worried about his heart attack risk. He was developing a little bit of spread in his midsection. He was developing some cough. His blood pressure was increasing. He and his doctor, and I'm blanking on the name right now, got together and said, well, why don't we do a stress test? They did. It was in the Tony Upscale's section of Georgetown. It was right about the time of the Cherry Blossom Festival in DC, which is beautiful. The temperature was nice and clear that day. He did fine on his stress test. So, you know, obviously you can imagine his reaction. He was getting worried. He knew he'd had a positive calcium score in the past. He knew he was getting more and more problems with his waist, with his blood pressure, etc. He was getting worried. He passed the stress test, so he said, you know, Gosh, I am so glad that happened. Maybe I'm out of the woods. Went back to work a couple of months later. He was doing voiceovers for Meet the Press. I think that's the name of that show. I can't believe I still can't remember whether it's Meet the Press or Face the Nation. I think it was Meet the Press. So anyhow, what happened was he collapsed doing those voiceovers. They tried a little bit of CPR. One of the employees there at the news station, where he was the, what do you call that? The chief, the boss. I forgot what they call that in the press vocations. Within about, less than 10 minutes, they got an ambulance out there. The ambulance took him to Sibley Memorial Hospital, and they never got him back. So why did I go down that bunny hole? And what's that got to do with acne? So here's what happened. They did an autopsy. They looked at the arteries, and they said that on autopsy, Tim Russert, Big Russ's arteries on the inside looked like the face of a teenager with acne. They had these just little pustules everywhere. That is what inflammation looks like in the artery wall. Thank you, Ruben. Angel Luis Fuentes, ketovore, mostly carnivore, pulls are plus, just some selected vegetables. Thank you, Angel. Within keto macros. Thank you. Metal 7 Core, what is your take on Paul Saladino's views on nutrition and health? Don't know Paul Saladino, don't know what his views are, sorry. Susie Penguin, thank you for the discussion. My husband is on regular keto, and I decided to try carnivore with a small amount of veggies for a little while due to my autoimmune condition. Thank you so much, Susie, for sharing that. And again, yeah, I understand exactly why you went where you went, especially if you've got autoimmune issues. Steve Sapel, good to hear from you, Steve. Haven't heard or seen any of your comments in a while. Hi, Doc. So can we generalize that all autoimmune diseases will have an effect on heart disease? Thank you for your videos. You cannot. However, you can generalize and say that most do. So, for example, I think most of us would say and are beginning to agree that Graves' disease, thyroid, the vast majority of thyroid disease ends up being an autoimmune disease, clearly associated with heart attack and stroke risk. Other inflammatory diseases. So, you know, maybe I should restate that answer. You can generalize it, and there are exceptions, but most autoimmune diseases, yes, do increase risk for cardiovascular disease. Furious Doe, always learning. Yes, I don't know if you're talking about me or you, but I'm certainly always learning every day. Thanks, Furious. Susie Penguin, in NutriSense. If you could send me that link, I would appreciate it. NutriSense. Oh, okay. Thank you. NutriSense.io. Okay, great. Stack 9866. Doctor, do you take inositol? I don't. I've seen some studies saying it works as well as metformin. I haven't gotten deep enough into, you know, several people have raised the question of inositol with me recently. It's one of those things where I put on my to-do list, but, you know, now that I'm retired again, I'm back to working intern level hours. I'm working 12, 16 hours a day on this channel, getting this information out, and I'm making less money than I did as an intern. But, you know, that's okay. We've saved up. We do not have expensive tastes, and I was in several corporate positions before, so we're fine financially. This is a labor of love. My point is, my to-do list, and inositol is included. I'll be lucky if I get to it over the next month. We got so many things going on right now. Furious Doe, by upgrading your T cells, can you protect against inflammation? It clearly depends on what you mean by upgrade. You know, this may sound very ethereal, to a lot of folks. But when you go back and you think about one of our more popular videos, like vitamin D and COVID-19, is that due? Clearly, I think it's not just me. It's not just a bunch of crazy supplement guys and etc. Taunting vitamin D anymore. Now it's even in mainstream medicine. Vitamin D having a positive impact on prevention for things like diabetes, and especially for things like COVID. Now, is that impact of vitamin D3, does that come from, quote, what Furious Doe is calling upgrading your T cells? Could be. I think that's part of the question. Sonity, speaking of autoimmune, do you have experience with patients with lupus or high APS antibodies? I certainly do. And thank you so much. You reminded me. The name of, I think it's Heidi Klum's husband, is Seal, S-E-A-L. He's a singer, and he's got lupus. And yes, I do have a lot of patients with lupus. Grace Harlow, would you suggest apple cider vinegar for OA? My hands are my problem, knuckles swollen. I don't quite get the apple cider vinegar connection to OA, but I do get the apple cider vinegar connection for diabetes. Vinegar is a base. It slows down the acid. It slows down the transit time in the stomach. And so therefore, if you ingest carbs, it's not like you're slamming your body, your bloodstream with those carbs as quickly as you would without the apple cider vinegar. So yes, there's clearly, you know, for those of you who think the apple cider vinegar is made up or silly or quackery or whatever, it's not. It does work. But at least the mechanism, the major mechanism that I'm aware is for diabetes and prediabetes, slowing down that that glucose slam to your arteries. Furious Doe, I do it with infrared heat. You do what? Oh, I was going to say you do what? I'm not familiar with doing T cell upgrades with infrared heat. There is how, you know, again, that may be one of those things where a lot of people say, oh, that's crazy. Go back and look at the infrared stuff and the infrared sauna stuff, for example. There's some stuff there. There really is. So Furious Doe's comment, there may be something there. Kyle Walker, recommended Crestor dosage. I rarely use more than 5 milligrams per day for Crestor. And I've got some people that just don't tolerate statins at all very well, but they need them, and they know they need them because they've got plaque and they've been in an inflammatory mode in the past. We've got some people as low as 2.5 once a week. Now, that's a tiny person, and that's a suboptimal dose. But I'll tell you, you know, the half-life of Crestor, rosuvastatin, is 17 hours. So there's reason to take it less than once a day. And guess what? There's science, there's research, there are studies that have been done on once a week Crestor, and it had an impact. Furious Doe, Doc. No, Doc, what I mean is putting your T cells by treating myself with far infrared, and until now I've had success. Thank you, Furious. Yes. Tayana Gary, my lung disease was cured with herbal medicine from mydidherbalmedicine.something. Okay, so here's Metal 7 Coreback. Paul Saladino is a fellow doc, MD, and YouTuber, author of the book, The Carnivore Code. He was recently on the Joe Rogan Experience. Well, Metal, I'll have to go back and take a look at him because it still doesn't, you know, I've shared a lot of, you know, maybe most of what I know about the carnivore diet. So I'm still not clear about what unique stuff Dr. Saladino is saying. Thank you for the clarification there. I think you two should do a collab. You know what, Metalcore? I would love to do a collab. You know, collabs are a collaboration. For those of you who don't know what Metal's talking about, a collaboration is where two people that have their own channels get together and do a couple of videos. Here's what happens with that. The audience from the first person's channel gets introduced to the second person and vice versa. And I would love to do that, even if it ends up at the end of the day, Dr. Saladino and I don't totally agree. Here's what happens. There's so many places where you do, you get a lot of people in both audiences that say, you know what, I'm so glad they did that. Now I found somebody else who's got maybe a slightly different perspective, but somebody I wanted to follow. Thank you so much for the suggestion. I will tell you, I've had so many people that used to, in my channel, that watch both me and Ivor Cummins. I've asked Ivor twice to do a collab, and crickets. I've done a couple of collabs with OAG, Old Alabama Gardener, and I'd be very, very happy to do some collabs with other folks. OAG ended up changing a little bit of his practice. He is the ultimate farm to table guy, and he actually ended up becoming a patient. He ended up sharing a lot of his own experience. He said, you know, discovering his carb problem saved his life. And what he did was changed a lot of his own gardening techniques and cooking techniques to focus a little bit more on low carb. Then you go Paul. You know, I used to have a friend called Vinny Gopal. Carom seeds have the effect of keeping calcium from entering the heart cells, blood vessel walls. I'd not heard that. Thank you, Vinny. Steve Mitchum, something must be wrong with YouTube's algorithm. It's saying that there are only 2 people watching. I'm getting, we were at 90 something a few minutes ago, Steve, and it's telling me we're at 78 right now. So, yeah, I think something's wrong with the numbers you're looking at. Furious Doe, Rhonda Patrick. Yeah, we'll get a lot of crossover with Rhonda Patrick as well. She has a video on T cells and sauna, so that's why I jumped in, and until now it works. Just want to share. Yes, actually, that was where I got interested and started on looking at the science behind infrared and immunity and saunas. She's a big sauna fan. She presented some pretty good science, and I think it's real. In fact, after going down that investigational channel, I started doing a lot more time in the sauna. I recently, about 2 years ago, moved right across the street from a wonderful YMCA. But guess what? A few months ago, a thing called COVID hit, and I haven't been able to get back in there. Paul Johnson, what's your effect on intermittent fasting? Paul, if you obviously haven't seen our video on intermittent fasting, we've got several of them, maybe a dozen or more. Here's a short story, and again, maybe here's another opportunity for a Bonnie Hall. So the day after Christmas on 2019, it finally appeared in the New England Journal of Medicine. So all these doctors that are ignoring this and saying that's a bunch of craziness really need, you know, if your doc does that, ask him if he believes the New England Journal, because the New England Journal had a great article on it. They said stuff like, you know what, we've known that caloric restriction, for those of you who don't know, caloric restriction is just eating, but eating the same amount, never really doing that much fasting, but keeping lower calories. It's always been shown to be a great way for longevity. What they began to do is go back and reanalyze old data about caloric restriction, and they showed that some of that was actually intermittent fasting. Won't go in any further detail on that, but they did that. They also said, look, it's time that intermittent fasting needs to hit mainstream. Doctors need to know about it. Nurses need to be trained in it. Health coaches need to be trained in it. They need to be able to teach patients how to do it. And they went into some of the biomarkers and the geeky stuff that we cover on this channel. So I'm a big, big fan of it. As I mentioned in the beginning of this, when we're looking at other content, we did a YouTube live just a a few weeks ago on this and asking the question, why are we still debating it? As I mentioned, there was an article that came out recently in the JAMA Internal Medicine that looked at this and didn't see a lot of improvement. So were they looking at the wrong stuff? Was this a random issue? Was it a problem? Is it really worth debating the value of intermittent fasting at this point? And I don't think that's the case. I think it's not worth debating anymore, and we need to just adopt it and move ahead. Susie Penguin, Dr. Saladino loves talking with other people with different views and experience. I'm sorry to hear you haven't heard back from Ivor. I am too. Anybody knows Saladino and would like to put us together, I'd be very happy to do that. Skunk Ape 79, don't get it, thank you much. Is oral health directly proportional to heart health? Great point. And again, I'd say venue, you probably haven't seen a whole lot of our videos in that space. We've probably got a couple of dozen. Here's a quick tip, quick and practical tip. Have you ever been to the dentist and your gums bled? The next question is, did your dentist tell you that by definition meant you had increased risk for heart attack and stroke? The answer to the first one is probably yes. Well over half of us have had bleeding gums. And the answer to the second one is probably no, because nobody's dentist tells them that. Dentists know about signs of prediabetes and cardiovascular inflammation about like even less about that than primary care docs know about prediabetes. It's bad in that space. But the answer is yes. And here's why. Here's one of the obvious. There are other connections, but the most obvious connection is what's the cause of bleeding gums? It's usually cardiovascular inflammation and prediabetes or diabetes. So yes, thank you, Venue, for bringing up a really good point. Skunk 8, link between smoking cigarettes protects from COVID. Don't quite understand that. Steve Sapel, have you heard anything about when a vaccine will be available for COVID? Oh gosh, you know, the last headline I saw was it's a debacle. I will say this. James from Open Health, James West from Open Health is back. We've got a large consulting group, as in one of the top 10 consulting groups in the world. We've done a lot of consulting. I got together a group of other Ivy League docs, and we helped do consulting for this group. I'm not mentioning the name. I think it's probably public, but I'm not going to take a chance. Anyway, they came back. That activity petered off. We were doing that for 3 or 4 months in the beginning of the COVID shutdowns. And now they're back and they're saying, look, there's a big, big issue with employers, their clients, the employers, on how and when to advise people for getting the vaccine. So we're gearing back up in that area. You know what? You hear about it. Most recently, one of the other ones went down for a while. Do I think it's going to be permanently a casualty? No, I think it's going to come back up like others have. Do I think we're going to be all beyond this and out doing business as usual January 1? No. Don't think it's going to happen that quickly. But yeah, we've got vaccines on the way. There's no question about that. Thank you, Steve. Good, interesting point. Can COVID lead to diabetes? That's actually, that's sort of backwards to what I've heard most people talk about. It's an interesting perspective, Venue. I don't think anybody knows. There's not enough long-term post-COVID to look at. Here's one thing I would say. I mean, it wouldn't be a surprise because post-COVID activities affect everything from your brain to your blood vessels, your arteries, etc. I'm assuming you do know, and everybody else here knows, that diabetes is a major risk factor for COVID. It's not a risk factor for getting infection by coronavirus SARS-CoV-2 or SARS-CoV-2. But once you get the infection, it's very much a risk. Diabetes is very much a risk factor for having major issues with it. Elizabeth Gerlach, I'm low 20 to 40 carbs, and if I fast 12 hours, blood sugar goes above 120 fasting. That is so interesting. Major cortisol response, huh? I don't think, though, that I would interpret that. You know, a lot of people would say, well, that means you're full-blown diabetic. I don't think so. I would love to see your OGTT or your insulin survey. If you don't know what that means and you'd like to find out, again, we can help. We're actually talking with a lab right now who's talking with us about making it much more affordable and easy and at home. Similar to the Meridian Valley labs where you do that home finger stick Kraft insulin survey, they're talking about doing that using micro pipetting techniques. So it's at home, it's cheaper, and we can get all that stuff done there. We're probably going to go out within a few weeks, hopefully, with some very rudimentary testing and gear up, maybe by the end of the year, with full-blown OGTT and IR testing. Furious Doe, Doc, I got a Soma mat from Get Fit, and you can put it on the bed. Afterwards, clean it, and it's not so expensive. I think you may be talking about that mat that has some of the infrared. I had a patient that had one of those. Furious, you're right about the dentist, Doc. No word from bleeding. Oh, I know. At one point, and that's not that, well, yeah, most of the dentists don't even know, but there are a lot of dentists that do. There's a fellow named Dr. Doug Thompson. Dr. Thompson has appeared on this channel many, many times. If you'd like to see some of his stuff, just go to my channel and Google Doug Thompson, DougThompson. He formed a group called the Wellness Dentistry Network, WDN. And that network is a bunch of dentists that understand oral systemic health. There's also a group called AOSH, AAOSH, American Association for Oral Systemic Health. It's mostly dentists and dental professionals that understand that bleeding gums is a big, big deal, more for your body health, your heart health, than for your mouth. Venue, is coconut oil bad for heart health? Gosh, you know, I'll tell you what, let me do short version. I take it, I put some in some sort of bulletproof coffee every morning. Skunk Ape, current smokers have a very much lower probability of developing symptomatic or severe SARS-CoV-2 infection compared to the general population. French study. Very interesting, Skunk Ape. Thank you for sharing that. You've been consistent and continued to provide more detail in that area. That is a very interesting study. I will be very interested to see if that turns out to be just a signal. In other words, you see it in one study, but you don't see it repeated. I'll also be very interested to do see benefits risks on that, because guess what? You know, obviously, you know, if you take vitamin D3, yes, people have died with vitamin D3, wrecked their kidneys, but very, very few. Smoking has been the #1 cause of death many times in many populations. So that is a tricky one. And again, look forward to seeing a lot more clearer detail on that. We've gone on much longer than we used to. The target is actually to do half an hour. Obviously, we blew past that. We've gone on an hour and a half. Thank you so much for so many of you who've remained, continued to watch, continued to demonstrate interest. We will see you next week. And we've got some videos in between. So again, thank you for your interest.